So at Tudor Reilly Health, we're pioneering efforts to reach patients with a rare disease online. We do that by producing great quality content that's relevant and useful for them, and then making sure it gets to the top of the search engines so that they can find it.
From my personal experience, the role of patient groups is really bringing people together. So our focus is first and foremost our children, our brothers, our sisters, our parents, the patients. And so really what we do is focus on finding treatments and helping them finding a cure. And so our role is bringing together all the different parties, the scientists, again, the medics, industry, the regulators, to focus on bringing a treatment to the patients as soon as possible.
I think that one of the important things is when it's quite a rare condition, you can feel quite isolated. There's only some people in the UK with it, and you're trying to find out the best way forward. So we have things like Facebook groups, which are quite good because they're international, people from different parts of the world, and it's generally through communication and support. Like I said, when things are very rare, it's unlikely you're going to know anyone face to face. It's just a means of making the world smaller, I suppose.
The internet is a vital tool if you have a rare or chronic condition. In our case, my daughter was misdiagnosed with cerebral palsy, so we mismanaged her condition for all of her youth. And it was only when she was 21 when we actually found it on the internet, when I was looking up the myriad symptoms that were just not making sense.
I think there are three reasons why drugs companies have moved into rare diseases very, very recently. One is the number of conditions. Each rare disease is, by definition, very rare, but actually, in total, you're talking about thousands of diseases. So the opportunity for drug companies is actually very substantial. The second reason is that, in terms of clinical development, clinical trials can be smaller, they involve fewer patients, and the timelines are shorter. So drugs companies can expect a more streamlined pathway through to approval. The third reason is economics. So orphan drugs can make a life or death difference to patients who need them, especially in areas where there are no alternative treatments. This means that payers are much more likely to reimburse them.
Well, on the one hand, you have patients with a rare condition, their families and their carers, and on the other, you have pharmaceutical companies who are developing new drugs that will be really helpful for them. So the opportunity is to bring those two communities together online, to make that connection in a way that's meaningful for them, and when you make that connection, to measure it.